Are bloodhounds prone to hip dysplasia? Hip dysplasia is a common medical condition that affects many dog breeds, and bloodhounds are no exception. This article aims to explore the prevalence of hip dysplasia in bloodhounds, its causes, and potential management options for this condition. What is hip dysplasia? Hip dysplasia is a developmental disorder that affects the hip joint in dogs. It occurs when the hip socket and femur bone do not fit together properly, leading to joint instability and subsequent degradation of the joint. Over time, this can result in pain, lameness, and loss of mobility. Prevalence in bloodhounds. Bloodhounds are a large breed with a distinctive appearance and a well-known sense of smell. Unfortunately, they are also predisposed to certain health issues, including hip dysplasia. While not every bloodhound will develop hip dysplasia, the breed does have a relatively high risk compared to some others. According to the Orthopedic Foundation for Animals, around 20% of bloodhounds are affected by hip dysplasia. This high prevalence suggests that breeders and owners should be aware of the potential risks and take appropriate measures to reduce the occurrence of this condition in bloodhounds. Causes of hip dysplasia. Hip dysplasia is influenced by both genetic and environmental factors. In the case of bloodhounds, genetics play a significant role in their predisposition to hip dysplasia. Therefore, responsible breeding practices become crucial in reducing the risk of passing on this condition to future generations. In addition to genetics, certain environmental factors can contribute to the development or progression of hip dysplasia in bloodhounds. Overweight or obese bloodhounds are at a higher risk due to the additional stress placed on their hip joints. Excessive exercise during the growth stage can also increase the likelihood of hip dysplasia. Signs and symptoms. Detecting hip dysplasia in bloodhounds can be challenging, especially during the early stages. However, there are some signs and symptoms that owners can watch out for. 1. Lameness or difficulty in getting up or lying down. 2. Hind limb weakness. 3. Decreased activity level. 4. Reluctance to climb stairs or jump. 5. Audible popping or grinding sounds from the hip region. 6. Changes in gait, such as a bunny hop-like movement. If any of these signs are observed, it is essential to consult with a veterinarian for a thorough examination and diagnosis. Management options. While hip dysplasia cannot be completely cured, certain measures can help manage the condition and alleviate discomfort in bloodhounds. These include 1. Weight management. Controlling your bloodhound's weight is crucial in reducing the strain on their hips. A healthy diet combined with regular exercise can help maintain an ideal body condition. 2. Medications. Non-steroidal anti-inflammatory drugs, NSAIDs, can be prescribed by a veterinarian to manage pain and inflammation associated with hip dysplasia. These medications can improve the quality of life for affected bloodhounds. 3. Physical therapy. Physical therapy and rehabilitation exercises can help strengthen the surrounding muscles and improve joint stability in bloodhounds with hip dysplasia. These exercises may include swimming, controlled walking, and specific range of motion movements. For surgical intervention, in severe cases of hip dysplasia, surgical interventions such as total hip replacement or corrective osteotomy may be recommended. These procedures aim to improve joint function and relieve pain. Bloodhounds, like many large breed dogs, are prone to hip dysplasia. This genetic predisposition, coupled with environmental factors, contributes to the development of this condition. By understanding the prevalence, causes, and management options, bloodhound owners and breeders can take appropriate steps to minimize the impact of hip dysplasia on their beloved pets. Regular veterinary checkups, responsible breeding practices, weight management, and adherence to exercise guidelines can all contribute to a better quality of life for bloodhounds affected by hip dysplasia.